Hey everyone, this is Dr. John Clayton, your Layton Chiropractor here in Utah. We are here at Supra Chiropractic with Whitley. She is 40 weeks pregnant, basically due today. So we're gonna give her an adjustment and hopefully she has the baby soon. So we're gonna get into that right now. Deep breath in here, all the way out. 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 So the sound that you're going to hear is from the table, not from the patient. It's called drop table. So I'm setting the SI joints, and then one thing I'll do to check the sacrum. The sacrum is one of the most important spots for adjusting during pregnancy. One way I check that is I bring the heels to the butt and check which side has more tension if I push. And that left side does. So then I want to adjust on that left side until the pressure is equal on both legs. Just like that. So another area we want to look at for the pelvis is looking at it from 360 degrees, which is adjusting the pubic symphysis right through here. So there's where the pubic symphysis meets together, there's two bones. So we're going to push on each bone and then figure out which side is more tender. Which side do you feel is more tender?
The right side.
So the right side's more tender, so we're going to just use the activator. We're going to go right here on top of that pubic symphysis. And then 3 clicks, we're going to adjust along the whole entire pubic symphysis bone to then level out the pubic symphysis, so then once it comes apart, the baby can come through and then it can line up properly again. One of the biggest things that happens if the pubic symphysis is off, let's say it's off, there's a dramatization, and it comes back together and it's not lined up properly, it can affect the pelvis and cause much more pain post-pregnancy. That's why we're doing it during the pregnancy check for all of our patients. And one of the other checks that we do is we're going to mainly look at some of the ligaments that go through, specifically one that basically connects to the front of the pelvis, basically to where the belly button is. Okay, so one way I check this is I take both the hands and I have you extend all the fingers out and I pull out and I lean back and I come together and I'm measuring where the fingertips are. So the fingertips are shorter on one side, then that ligaments are tighter. So on this left side here, the ligaments are tighter. So then what we do is I just imagine like there's an imaginary cord going through the belly button to the front of the hip here. And I mainly am just kind of wiggling back and forth very gently as I kind of loosen any tension in that cord. This has no effect on the baby at all. It's mainly just to help loosen up everything so the baby can come out properly. So I go back and forth, and then one way I'll check this is the same process of bringing the hands out, leaning back, bringing the fingers together for them to line up, which they do. And then as we're getting to the neck, one of the common misconceptions with adjusting pregnant women is that it needs to be forceful or painful for them. Because they have so much relaxin hormone going through their body, they tend to be more relaxed as a result. And so, especially when adjusting, it's almost more gentle than any other adjustment on a pregnant woman because you don't need to push that hard or try that hard as far as adjusting goes. So when we come to the neck, we can simply just get in the position to adjust and push, and it just goes right in place. There. Just like that. Take a deep breath in, all the way out. Good. And then we just decompress right at the end. All right, so we finished up the pregnancy adjustment that we've done here on Whitley, and we got through the major areas. The things that we focused on were the alignment of the upper back as well as the pelvis, working all the way around 360 degrees on the pelvis. We worked through the ligaments, and then we adjusted the neck. And so those are the main areas that I focus on with pregnancy adjusting. If there's any other questions that you have about pregnancy adjusting, feel free to reach out to me personally, either through Instagram, Facebook, or leave a comment on the video in YouTube. If you'd like to see more videos like this, let me know what you'd like to see. Again, I'm Dr. John Clayton, your Layton chiropractor here in Utah.